Have you ever wondered, can you really trust a psychiatric diagnosis? It's a fair question, and an important one. Because when someone hears the words bipolar, ADHD, depression, or schizophrenia, it can change everything. How they see themselves, how others treat them, and the direction their entire life might take. But what exactly is a psychiatric diagnosis? And how reliable is it really? Let's break it down, simply, honestly, and with compassion. What is a psychiatric diagnosis? Unlike most physical diagnoses, like a broken bone or diabetes, psychiatric diagnoses don't rely on blood tests, X-rays, or MRI scans. Instead, they're based on patterns of thoughts, emotions, and behaviors. Psychiatrists and mental health professionals use a book called the DSM, the Diagnostic and Statistical Manual of Mental Disorders, to identify these patterns. Think of the DSM as a big checklist. If your experiences match enough items on that list, you may be diagnosed with a condition. For example, feeling hopeless, trouble sleeping, losing interest in things you used to love. Check enough of those boxes over a certain time period, and you might be diagnosed with major depressive disorder. Sounds simple, right? Well, yes and no. The strength of a psychiatric diagnosis. Let's start with the positives. For many people, getting a diagnosis is a relief. It gives a name to what they're going through. It validates their suffering. It can guide treatment, medication, therapy, lifestyle changes, and it can help them access support, school accommodations, disability benefits, or even just understanding from family. In the right hands, a psychiatric diagnosis is a starting point for healing. It says, you're not lazy, you're not broken, you're not alone, you're going through something real. That alone can be powerful. But here's the complication. Psychiatric diagnoses aren't like diagnosing strep throat. There's no throat culture for anxiety, no scan for PTSD, no lab test for borderline personality disorder. They're based on observation and conversation, and that introduces some human error because people are complex. One person's sadness might be grief, another's might be depression, one child's hyperactivity might be ADHD, or it might be trauma, or lack of sleep, or just being 6 years old, and sometimes even well-trained professionals don't agree on the diagnosis. Different clinicians might see the same person and come up with different labels. That doesn't mean the system is fake, it means the brain is messy and behavior is complicated. The gray zones. Let's be honest, some diagnoses overlap. Depression and anxiety often come together. ADHD and bipolar disorder can look similar. Trauma can mimic many other conditions. Sometimes people receive multiple diagnoses over time, as if they're trying on labels that don't quite fit until one feels right. This can be confusing, frustrating, and even disheartening. But it also reflects a truth. Mental health is not black and white. It's a spectrum. It evolves, and a single diagnosis might not tell your whole story. Cultural and social bias. Here's something we must talk about. Psychiatric diagnoses don't exist in a vacuum. They're shaped by culture, race, gender, and society. Studies show that black men, for example, are more likely to be diagnosed with schizophrenia and less likely to be diagnosed with mood disorders, even when presenting with similar symptoms as white patients. Women are more likely to be diagnosed with borderline personality disorder, while men might get labeled with antisocial behavior instead. Sometimes, what gets labeled as disorder is actually a cultural difference in expression or experience. This doesn't mean psychiatry is useless. It means we need to practice it with awareness, humility, and ongoing learning. Diagnosis versus identity. Here's something else to consider. A diagnosis is not your identity. You are not a bipolar person. You're a person who lives with bipolar disorder. There's a big difference. Labels can help us understand our experience, but they should never box us in, because no diagnosis can define your heart, your spirit, or your potential. Remember, a diagnosis is a tool, not a verdict. A compass, not a cage. Can diagnoses change? Yes, and they often do. People grow, minds heal, circumstances shift. What was once depression might lift with time and support. What looked like ADHD might turn out to be anxiety or unresolved trauma. A diagnosis can change as your life changes, and that's not failure, that's growth. The best mental health professionals update their understanding as they get to know you. They stay curious, they listen, they don't just rely on checklists, they treat the person in front of them. So, can you trust a psychiatric diagnosis? Here's the honest answer. You can trust it as a starting point, not an absolute truth. It's a lens, a framework, a way to understand what you're going through and how to help. But always remember, you have the right to ask questions. You have the right to a second opinion. You have the right to evolve beyond the label. And you have the right to be seen as a whole person, not just a diagnosis. What to do if you're diagnosed? If you've recently received a psychiatric diagnosis, here are a few gentle steps. Take a breath. A diagnosis doesn't mean you're broken. It means you're being heard. Educate yourself. Read from reliable sources. Ask your provider to explain. Knowledge is power. Explore treatment options, medication, therapy, lifestyle changes. Recovery looks different for everyone. Talk to people you trust. You don't have to go through this alone. Community matters. Stay open. This diagnosis might shift over time. That's okay. Growth is part of healing. Final thoughts. Mental health is a journey, not a straight line. A diagnosis can be a helpful signpost, but the path is still yours to walk. Trust your experience. Ask good questions, and never forget you're more than any label, because at the end of the day, we're not just trying to name what's wrong with people, we're trying to help people feel whole again. And that takes more than a diagnosis. It takes care, it takes humanity, it takes hope.